Pregnancy 101, Part 7. We are still talking about misperceptions and myths about miscarriage. Now, I am switching the green screen over to this website. If you just go and Google causes of miscarriage, at least for me when I Googled it, the first hit is from this website from the Cleveland Clinic, and it looks pretty good. So I recommend that Google get you to the right spot for this one. And right away, having a miscarriage does not necessarily mean you have a fertility problem. Most women, 87%, who have miscarriages have subsequent normal pregnancies and birth. All right, beyond that, what are some other important things that you can get from the website? They have a nice list of known causes of miscarriage. We talked previously about uterine abnormalities, chromosomal abnormalities, and the fact that most people, they don't get any sort of known cause when this happens. It just kind of happens. It's common. All right, so from their list, possible causes, known and unknown factors: infection, exposure to environmental and workplace hazards. Yeah, sometimes people don't know that those hazards are there, so you don't necessarily need to be blaming. Hormonal irregularities, that's a big one. Sometimes they try to intervene with some type of hormonal therapy, doesn't always get the job done, and you have to know that it's there ahead of time. We've already mentioned implantation issues. Lots of things can interfere with implantation. One risk factor, not really a cause, but a risk factor, is maternal age. Being over 35, and then even more so when you're over 40, is associated with greater risk, and a lot of these things are more common when someone is of what they call advanced maternal age. It's not like a direct cause, but it's a risk factor. Another thing that we have not talked about is incompetent cervix, that opening between the vagina and the uterus. It is supposed to stay closed during the pregnancy. In fact, it forms a little plug so to try to keep everything in there. Sometimes it doesn't work. Sometimes it will start to widen and open too early, and this is a problem. And so that's one thing that can happen. That's not something that the person who's pregnant did. It just happens sometimes. They do mention lifestyle factors. Here's where you can go wild with your blaming. All right, they do mention smoking, alcohol, using illegal drugs. They also mention disorders of the immune system: lupus, autoimmune disease, kidney disease, congenital heart disease, diabetes that's not controlled, thyroid disease, all right, strep, severe malnutrition, lots and lots of things that are on there. You notice how a lot of these, but most of these, are not something that you can blame the person for. So that is a big thing to point out. We're going to talk about stillbirth in that next part.